So what's coming to mind is the coach model here,
Yeah.
which is very popular.
Uh-huh.
There are coaches all over the place for different things. Why not? The doctor is a
Uh-huh.
coach, because I'm looking at your three categories in this visual, and self-care kind of is
So self-care could be a core, right? How
core.
you treat yourself, and um, being being the physician that's aware of that, being actually talking to my patients and getting a sense of how they take care of themselves and how we could potentially, or how people could potentially improve how they take care of themselves. But also maybe the next envelope here, the next concentric circle might be, other holistic treatments that the person's already engaged in.
Mhm.
So, the person that, sees their acupuncturist once a month, to be able to work with that, cherish that, understand how alternative medicine works, but also maybe the third concentric circle around that is to be able to also, look from the perspective of the conventionally trained doc and be able to know, when should you be concerned that a symptom is more concerning for a heart condition and be able to evaluate that, or when is a medication indicated, or how can we gently taper off medications and use more antioxidants and herbs and be able to kind of elegantly step away from a narrow-minded pharmaceutical treatment program.
And if I may use the coaching metaphor again, um, you know, somebody who's, let's say, very adept and interested in self-care, they may do quite a few things on their own, but then when they need some expertise in healing modalities, uh, then you can step in, and sometimes you may go to the team approach, uh,
Yes.
which is important, as is any good coach on any good team. They have assistant coaches, or
Yeah.
they have people that feed in because they can't watch everything.
Right.
So I like that. I like that multidimensional, multidisciplinary approach to health and healing to meet the ever-increasing demand for total wellness. That's a mission statement almost.
Yeah. So I've worked alongside of lay practitioners, or um, other more sophisticated practitioners, and um, as of late, I've worked a lot with the Life Vessel Santa Fe group and really enjoy very much the partnering with them. And they have access to some pretty amazing tools to help to detoxify the body from the actual life vessel machine, and things like infrared sauna or colon hydrotherapy. And but yeah, I think I have something to offer in the context of a person uh, working with a healing center.
Mm-hmm.
I've worked very closely with Santa Fe Soul. They're another holistic healing center in Santa Fe. I work very closely with Dr. Vince Palladino, and then partnering with the likes of you, Alan, in terms of being able to get information out. And I hope that this podcast series is a useful tool in educating my patients and even the public at large on integrative approaches to healing.
Maybe we can mention there's 16 different topics that Russ has identified. Why don't we cover the first couple in the list?
Maybe the first topic, what I might call a paradigm shift to integral health. I think one of the shortcomings of conventional medicine is that it overemphasizes data. It overemphasizes labs and blood pressure and cholesterol numbers, and doesn't appreciate the person's inner experience. So, yeah, I think that both objective data and inner subjective experience are very important to acknowledge.
All right, so that might lead us to the second thing. The current U.S. healthcare system maybe relies too much on the cookbook data results and doesn't add that other dimension that you're talking about that you try to integrate with the team. You want to chat about how you see the current U.S. healthcare system, and
Right.
is
So
there
we
hope for us folks here?
Well, I think that in the recent ongoing dialogue about healthcare, we're as a nation trying to increase access to healthcare. But I have a concern about the type of healthcare that we have access to, and I think I've said before that we may have access to as a nation the 7-minute visit with your primary care doc, where you may not really be able to have a thoughtful discussion about your concerns and your goals. It may be more data driven. It may be more about checking your blood pressure and looking at some numbers on paper and maybe giving a prescription, and then your provider reaches for the doorknob and it's all over.
And I would imagine, speaking about prescriptions in the pharmaceutical industry, their programs are very strongly address symptoms with a pharmaceutical product, and that has some deep caveats or cautions that I've learned, and I know
Mm-hmm.
you know as a doctor, that
The conventional approach, and I think you're outlining the conventional approach being very pharmaceutically based, versus what I might call metabolic medicine or functional and metabolic medicine, where the difference would be that the conventional pharmaceutical approach is that way because you can patent these molecules, and it works very well in a capitalist society. Definitely does save some lives, but I think that tends to treat symptoms. And the difference would be that metabolic medicine really tries to understand the underlying, deeper, functional reason for what's going on. So trying to, and sometimes I'll actually, I have this little picture of the iceberg. The conventional doc, sees what's above the water and treats what can be seen, in the blood pressure.
so you got to look under the surface where 9/10 of things are going on or more.
Yeah.
All right, we're going to talk more. We're going to take a break here. Thank
Thanks,
you.
Alan.
All right, more to come.